One of the most concerning things about an abdominal wall hernia are the symptoms that it causes. The symptoms of an abdominal wall hernia can range all the way from no symptoms to excruciating pain. One of the most common symptoms we see for abdominal wall hernias is the onset of pain. Certainly, as we discussed in a prior video, an abdominal wall hernia is a hole in the muscle through which fat or intestine pushes out of the muscle. When that happens, it can cause pain, either acute, right when the hernia forms and right when the intestine pushes through, or it can be more chronic in nature, and over the course of months and years, as the hernia gets larger, that pain can increase. So either acute pain when a hernia forms, or chronic pain over the course of several years is probably one of the most common symptoms that I hear from my patients for abdominal wall hernias. One of the other common symptoms that we hear from our patients is a bulge underneath the skin. Again, as we discussed, fat or intestine is pushing through the muscle, and when that happens, you see a small bulge underneath the skin. That bulge can form in the groin for an inguinal hernia, or it can be at the belly button if you have an umbilical hernia. Sometimes patients describe the ability to push the bulge back in, which is very common, and that's called reducing the hernia. So when the hernia is reduced, that bulge may go away, but as soon as you stand or begin to exercise again, often that bulge will return immediately. Some other symptoms of abdominal wall hernias can be chronic constipation. If there's enough of the intestine inside of the hernia, it can limit the passage of food through that intestine and can cause constipation, or in some cases, nausea, vomiting, and bloating. Although rare, those are symptoms that we see in our practice. One of the more concerning and life-threatening symptoms from an abdominal wall hernia can be what's called strangulation. Strangulation is where a piece of intestine gets trapped in the hernia and is not able to come back out. When that happens, the blood supply to that piece of intestine becomes compromised and the intestine actually starts to die. Because the blood supply is cut off, patients develop severe amount of pain, nausea, and vomiting, and are often rushed to the emergency room. In the emergency room, if they're diagnosed with a strangulated hernia, it requires emergency surgery to open up the hernia, push the intestine back in, and sometimes even take out that piece of intestine if the blood supply has been damaged too much. The risk of strangulation for a hernia is very low, but it can happen, and I tell patients the chances of developing a strangulation with an abdominal wall hernia is approximately 1 to 2% per year. So you could live 20, 30 years and maybe only have a 20 to 30% chance of having your hernia strangulate, but certainly that risk is always there as long as you have a hernia. So again, most common symptoms are pain, whether acute or chronic, a bulge underneath the skin that may come and go depending on whether you're lying down or you're able to push the hernia back in, constipation as well as intestinal obstruction, nausea and vomiting, as well as strangulated hernia, which can be an emergency.